You might remember earlier this year, San Diego County's Board of Supervisors declared COVID misinformation a public health crisis.
To combat this, county leaders are taking action, including holding a number of online panels with medical experts to dispel the myths surrounding the virus and the vaccine. News 8's Richard Allen has more on today's discussion.
Well, that's right. These panels strive to set the record straight on coronavirus, focusing in large part today on the COVID vaccine for children.
I think it's compelling to say that kids do need the vaccine.
Dr. Mark Sawyer, a pediatric infectious disease specialist at Rady Children's, pointed to the fact that among children 5 to 11, COVID-19 is currently the 8th leading cause of death.
Kids between 5 and 11 are not supposed to be dying at all.
Stressing the safety and importance of getting the Pfizer vaccine now that it's received emergency authorization for those 5 and over. One of the most alarming side effects of the COVID vaccine among youngsters, which many anti-vaccination proponents have latched onto, is the risk of myocarditis or inflammation of the heart muscle. Medical experts concede while this is a recognized side effect, it is not a reason to skip the vaccine.
And I want to assure people that it's exceedingly rare. Unlike the hospitalizations and heart problems from COVID itself.
In fact, doctors on Wednesday's panel stressed that a great deal of COVID misinformation stems from reported side effects online. The site Vaccine Adverse Event Reporting System, for instance, is open to the public, and the CDC encourages people to report adverse side effects to the database after vaccination, even if they're not sure whether the vaccination caused the adverse event, meaning data from the site should be interpreted with those limitations in mind.
Just because something happens the day after you're vaccinated doesn't necessarily mean the vaccine caused it.
The panel also tackled myths over mask wearing by kids, pointing out it's often adults, not their children, who have the most difficulty with wearing a face covering.
But it does prevent, and as does vaccination soon, prevent them from having to quarantine and things like that if they don't get COVID because they have their mask on. So there's a real benefit to it.
And if you'd like to check out this panel discussion for yourself, we have a link. Just go to cbs8.com, click on the online version of this story.